Hi, I'm Dr. Crystal Coyne, your pharmacist. Today we're going to focus on zinc. This is an important topic because it's an over-the-counter supplement, which means that many people assume that it is safe without realizing that there is a standard dosage, an upper limit dosage, interactions to medications. And with COVID-19 that's been around for a few months now in our communities, along with influenza season coming up, we've seen many calls to the Poison Control Center due to zinc poisonings. So let's talk about zinc a little bit. Zinc is an essential mineral. It's involved in numerous aspects of cellular metabolism, playing a role in immune function, in protein synthesis, wound healing, DNA synthesis, as well as being required for about 100 enzyme reactions in our body. Zinc supports normal growth and development, and it's needed for proper smell and taste. Because we do not have a specialized system that stores zinc in our bodies, we do need a daily intake. That way we keep a steady state. Recommendations for supplements are provided in the Dietary Reference Intake, otherwise known as a DRI. We would like to find the recommended dietary allowance, which is a RDA. So if that's available for the product, we want to try to reach that goal. That's just an average daily level of intake that's sufficient to meet the needs of most healthy individuals. If there's not an RDA, you'll see adequate intake, and that just means there is insufficient evidence to develop the RDA. Here is a simple chart to show what the recommended dietary allowance is, along with the upper limit for zinc. Our RDA of zinc for those that are 19 or older is 11 milligrams for males, 8 milligrams for females. But please note, if you are pregnant or breastfeeding, you will need a higher intake, and the intake is lower for many of our elderly population. Sources of zinc, we have food and we have supplementation. In food, we have a wide variety to choose from. In the American diet, our most common place is going to be red meat and poultry. That's where we get the most in our diets day to day for most Americans. But we're also looking at things like beans, nuts, certain types of seafood like crab or lobster, whole grains, fortified breakfast cereals, and dairy. Do be aware though that phytates, which is something that's in whole grain breads, cereals, legumes, and other foods, bind to zinc, inhibiting its absorption, which just means there's less availability in the body to actually be used. So even though we have a higher source coming from our animal-based products, our grains and our plant-based foods are still good sources. So let's go to the pharmacy and take a look at what's available supplementation-wise.
Oh, there it is. 50 milligram. Well, the doctor said to take 200. Is there any 200s anywhere? Well, I guess I'll take this one, so that's the only one I can find, and I'll just have to take 4 of them.
What I've seen so much of lately in the pharmacy is patients coming up to the window looking for zinc. They're having difficulty finding it on the shelf, so they're looking for some help. And every now and then there'll be a couple choices out there, but all the choices are labeled 50 milligram, but they're coming to the pharmacy with a handwritten note from their doctor saying to find 220 milligram. So patients are asking, can I just take 4 of these? Is that the same thing? And we have to be very careful because there are different formulations of zinc. But what's important is the elemental amount, which is the amount the body can actually use. So in all reality, the packages that we have, the 50 milligram that's available, is the 220 that the doctor is requesting the patient to use. So I think a lot of these poisonings and overuses are just coming from simple misunderstanding. So had that patient looking for the 220 milligram zinc in the aisle had come to the pharmacist to ask that question, she would have been properly informed, educated, and aware, and most of all, been using the product safely. Zinc sulfate and zinc gluconate are the most common forms we will find in a community pharmacy. You see here, this is labeled as 220 milligrams of zinc sulfate, which is what most providers will write a note or verbally tell their patients to pick up at the pharmacy. However, these products have mostly been relabeled. So now you will find zinc 30 milligram or 50 milligram, and you can find the source on the label that's on the back side. So providers are not realizing that these have been relabeled, letting their patients know that they suggest 220 milligrams of zinc, and patients are coming to the pharmacies looking for that, and they are only able to find 50 milligram labeled packages. So one reason we might take zinc supplements is because we are believing ourselves to be deficient in zinc. I defined RDA earlier, which covered nearly all healthy individuals. Another measurement is the estimated average requirement, or EAR, which is the average daily level of intake estimated to meet the requirements for about 50% of our healthy population. We have an analysis study that found around 40% of people that are aged over 60 years old had zinc intakes below the estimated average requirement. And of those 40%, when we looked at our dietary supplements and food, 23% were still receiving an inadequate intake of zinc. So that's to say, with vitamin supplementation and with our dietary intake, we're not doing all that great, especially as we age, at getting enough zinc. However, in North America, overt zinc deficiency is very uncommon. We really see this more in children that are in developing countries, but we do have populations that are higher risk. So those would be those with gastrointestinal diseases such as ulcerative colitis or Crohn's disease, those that are vegetarian, pregnant women or lactating women, older infants who are exclusively breastfed, people with sickle cell disease, or alcoholism. Some benefits of taking zinc do revolve around our immune function. So we know that the body requires zinc to both develop and activate T lymphocytes. So having severe zinc deficiency can depress our immune system. Mild to moderate deficiency can have some effect on the components of immune activity. Zinc plays a role in wound healing as well because zinc maintains the integrity of the skin and the mucosal membranes. I think the most common thing we think of when we think about reasons to take zinc, at least for treatment of something, would be the common cold. So this time of year, especially with influenza season coming around the corner, zinc flies off the shelves. And currently with COVID-19 in our communities, it's very difficult to find in the drugstores. But studies that examine the effect of zinc on the common cold with both symptoms and duration have been very conflicting. So there's not great evidence showing one solid answer, but overall zinc appears to be beneficial in certain circumstances. So I would recommend that if you do plan on using zinc to help shorten the duration of your cold, that you start taking zinc gluconate lozenges within 24 hours of symptom onset. Now remember to follow the package instructions. You do have to use the lozenges multiple times throughout the day, usually every 2 to 3 hours. The other option that you have in stores often you'll see is a zinc nasal spray. However, I would not recommend this as the safety has come under question due to the loss of smell, in which many cases have been reported to be permanent. Having too much zinc can lead to toxicity, so there are established tolerable upper limits, which is 40 milligrams. When we have zinc toxicity, we have short-term sudden effects, and we also have more chronic, long-lasting effects. Some of the acute symptoms that occur would be nausea and vomiting, stomach cramps, diarrhea, loss of appetite, or headaches. Doses of 150 milligram to 450 milligram daily been associated with more chronic effects like low copper status, altered iron function, reduced immune function, and reduced levels of high density lipoprotein, which is HDL, otherwise known as our good cholesterol. In 2007, the Journal of Urology published a study showing that the dosage of zinc used in the eye vitamin AREDS, which was 80 milligrams a day, when used over a long term, which the average of the study was 6.3 years, on average, found that patients had more hospital admissions due to urinary issues. So that is something to think about as well. Many of our older population, even though they might be deficient in their intake, they're now on a higher dosage. It's being put into their system every single day, because often they're on things like AREDS or other supplementations that they might not even realize also contain zinc, and that adds up in the system and can lead to long-term chronic effects. And keep in mind, zinc interacts with many medications. So we'll go back to the pharmacy and talk about some of those, but one of the most important ones I want everybody to be aware of is antibiotics. So if you have zinc, which is in your multivitamin, for example, it doesn't have to be zinc by itself, but you also have an antibiotic, it does interact in the gastrointestinal tract, which means you're not getting the zinc that's absorbed in the system, and you're not getting the antibiotic absorbed in the system. So please be aware of that. Zinc does block the absorption of many medications, meaning that it's now building up in your system more because it's not being excreted and often not used properly.